I remember getting the update from the command center when there was this feeling that we're probably going to flood. The sump pumps were all on, the water was coming through the walls, and frankly, I think I've heard you say, and many people say, the fact that we didn't flood is miraculous, an act of God, sheer random luck. But there was that one moment in time where I think most of us thought we were going to flood. Are you still thinking about what's next, or where are you going at that moment?
Well, at the moment where it seemed obvious that we would flood, and again, our concern was our infrastructure was all below ground. And I had witnessed and saw for myself the sandbags that were being lined up around the hospital at all the doorways of the hospital, both campuses, to make certain that the water did not come into the building. But the whole time thinking there's no way that we're going to avoid losing everything because of the infrastructure being below ground. And added to that, I had received a report that our laboratory located at Pouch on Edgewater had already been destroyed. There were tankers, ships on the shore not far from there that had actually been pushed up. These massive tankers had been pushed up onto the shore in Rosebank. The offices across the street from the hospital were flooded. The cars that were parked in the administrative parking lot were underwater. So we saw all this happening, buildings underwater, people having lost their homes underwater, and here we are in the middle of all that, surrounded by houses that were flooded, thinking, how are we not flooded? And when you say miraculous, I agree with you. You could go past Highland Boulevard, areas that never get flooded, they were flooded, houses were lost. And we were in the middle of that, at the center of that, and we did not get water into the hospital plant itself. And I have to think about divine intervention, but I also have to think that the skill of the people who secured the hospital in preparation for flooding did such a good job that it held back the waters.
Listen, there was a lot of work that had gone into it. I know for a fact that there were actually multiple sump pumps in the basement. There were also multiple extra sump pumps with human beings holding the hoses to the sump pumps to guide them into other sump pumps to get the water back out above ground. And to this day, I don't totally understand how it didn't happen. And I think to believe that there's some kind of divine intervention there, I think it makes a lot of sense in this one particular thing, because the danger we would have put all Staten Islanders into by that happening. And so my last question on this, which is, I think that was the moment that we all realized, my gosh, if this building shuts down, this is the real tertiary care medical center for the borough of Staten Island. If this building shuts down and we're forced to close it for, let's be honest, I think history has told us, for a few months, which is what happened, with other places that closed down. This isn't Manhattan where there's, you close your eyes and you're going to trip over a hospital. This is Staten Island. The legacy of that is we have to do everything in our power to not let this happen again. So how do we take that from an idea to the beautiful new building that we're actually seeing, which will hopefully be done at the end of this year, beginning of next? Because really this is, frankly, a big part of your legacy with Staten Island University Hospital, is to go from the idea to the actual building. There's a lot of hurdles you got to jump over. So how do you get that started?
So it goes back to what I talked about earlier, and that is developing relationships, again, with the community leaders and with the elected officials and the people of Staten Island. The idea was knowing that we escaped by the skin of our teeth, and knowing that it took every bit of a miracle to keep that hospital from shutting down, as we saw at NYU. Flooded, had to be shut down. Immediately, following everything we needed to do to secure the hospital, immediately reached out to our elected officials. That conversation actually began when we had a visit from Lawrence O'Donnell, who came to talk about a video that he had made relative to the resiliency of the people of Staten Island. Fans of Lawrence O'Donnell were Jim Otto, Mike Cusick, and other politicians, other elected officials who came to see his presentation. At that moment, I started working on our elected officials. We need money. We need to go out. We need to improve the infrastructure. We need to get our infrastructure out of the basement where it is in its greatest jeopardy of being destroyed. We need to move it up. and we need funding for that. Through the efforts of our local elected officials, we made arrangements to have a representative from FEMA come to our campus, and as good neighbors, we invited Richmond University Medical Center to join us at our campus so that we could talk about the needs of the hospitals of Staten Island. The borough president was there, some other elected officials, the chairman of the board of Richmond University Medical Center was there, our own chair, and we took them on a tour of the facility, going underground to our infrastructure. We talked about the financial needs that it would take to actually elevate our infrastructure, build a new building, put the infrastructure into that building above ground so that we would never have to worry about flooding again. So the process began immediately. We couldn't wait for another flood. We couldn't wait for another hurricane. We couldn't wait for another superstorm to begin the process. FEMA came along, they took a tour. Eventually that led to the promise of millions of dollars, and eventually it led to actually receiving, even after I left, that number had increased to $40 million. And through that, we've been able to see that the hospital has improved its infrastructure, is about to open a building that will provide services to women and children across Staten Island. And we can say that the success of something that came out of something terrible, the success that we have is that today we can look at that and say this is what we've done to improve healthcare in this community.
One of my first acts in this role was to go to the topping of that building. To give you an idea, there's so many things we're trying to open, so many things we're trying to construct, and we talk about the new cancer center, we talk about the women and newborn center. But the reality is, if we hadn't squared away the master facility plan, and if we hadn't squared away the central utilities and figured out how we protect our institutions, I'm not sure we could have done any of those things. Because the reality is, you can't take those kinds of risks with real human beings. And this is the only tertiary care center on Staten Island. And the risks you're taking by not having it protected are immense with people's lives.
You know, mentioning the topping ceremony, which you know has such great significance, because that's at the moment that you realize that this is actually going to happen.
It's going to happen.
And you reminded me of a topping ceremony that was held several years ago, I guess it was 2008, for what would become our new emergency room. And you were very much a part of that. And I give myself some credit for that because I selected you for the role of chairman of emergency medicine at Staten Island University Hospital. Proved to be a very good choice, by the way.
Thank you.
And, but I recall what you had done then, and I was fascinated by it. And you walked into, first it was a prototype room, where we had taken a room and just shut everything down, and on the walls, you started with drawings of where you wanted all of the electrical outlets, where you wanted the lines for the oxygen, and you basically drew on all the walls. And from those drawings, and I think about it because I'm a frequent flyer in the emergency room, when I think about it, every time I walk into one of those rooms in the emergency room, I look on the wall and the placement of the oxygen and the outlets and all of the things that would be needed by a physician or a nurse that's caring for a patient in an emergency situation. I think about the advances that are made in terms of it. Your job never ends. You're always trying to improve. You're always trying to get better. You're always trying to get newer, because healthcare advances so quickly, medicine advances so quickly, and you have to be prepared for the unexpected, as COVID showed us. You have to be prepared to deal with the unexpected. And that's your legacy when you walk through that emergency room and you see what's in there. And you see that that started with one emergency room physician drawing on a wall and deciding, this is where I'm going to put that outlet.
Yeah, I drove the architects crazy, but it was it was a lot of fun, and I do feel like I learned a lot in the process. And it's amazing how, if you put the right people into a room, you know, a lot of thought went into what it actually looked like. And I think it's the beauty of trying to listen to the people that actually do the job, and it's something that we always try very hard to do.
Absolutely.
Well, I do want to thank you.
My pleasure.
And not just for doing this, but really for being a part of steering a battleship through many years and of leaving it so much better than you found it.
Thank you. It's very kind of you. Thank you.
Yeah, and I think it's all we can ever ask for any of our community leaders is that whatever they decide to do, they leave it slightly better than they found it. And for you, I don't think it's even slightly. I think you really, and part of it is through Superstorm Sandy, part of it is just through the planning of the institution. So I do thank you for that, and Staten Island thanks you for that.
Thank you. It's a pleasure to be here. Thank you very much.